I'm Dr. Jared Harrell, primary care sports physician at Colorado Center for Orthopedic Excellence. I'm board certified in both family medicine as well as primary care sports medicine. So one question we get often in primary care sports medicine is about what is regenerative medicine. So simply put, regenerative medicine is a way of taking our body's own cells, injecting them into damaged or injured tissue, and trying to get the body to heal itself. There's a couple different cell types that we can use to do that. One is platelets, the other would be stem cells. So there's a lot of conditions that we can use these cells to our advantage to try to promote healing. If you think about each joint, the shoulder joint, you may be able to help response for a rotator cuff injury, for arthritis, for labral tear. Regarding the knee, same thing, osteoarthritis, chronic tendon issues, go to the foot and ankle, plantar fasciitis, Achilles tendonitis. There's any number of conditions that are often responsive to these treatments. When we use platelets, we simply draw your blood, spin them down, and then find the diseased or damaged tissue by ultrasound. Once we identify that tissue, I place the needle directly into the area of interest, and then we simply inject those cells back. Stem cells are a little more complicated. We do have to aspirate your bone marrow and then use a FDA-approved device to spin that down to extract as high as concentration as we can of the stem cell. Once we identify the area of concern again by ultrasound, we then again simply inject those cells back into the body to try to elicit that response. Certainly some of the conditions I mentioned are most common, but there are a lot of conditions that we can use the benefits of these cells to our advantage. Unfortunately, one of the other questions that comes up about regenerative medicine is, will my insurance cover it? The short answer is probably not. There are some insurance companies that may cover some of those, such as work comp, but generally speaking, they will not cover these procedures, citing that there may be some lack of evidence and or experimental component to those procedures. I don't think that it's necessarily true that we would say that they're experimental, as these have been done for more than a decade. Also, as far as experimental treatments go, we're assuming that we don't know what these cells do or what their capabilities are, which would also be false. So I think the biggest issue that we have with insurance companies covering these procedures is simply long-term data. So what I do tell patients is there are some things that we are pretty good at predicting how they're going to respond and for how long. Others we're not entirely sure. But what we can say is that patients often do say that they got significant benefit from procedures. Benefit we would determine or decide as more of can they move better? Are they having less pain? And do they get more out of life? So I think it's worth at least checking those things out and comparing those to typical surgical interventions and deciding if it's right for you.